Let's talk about attachment. It's the emotional bond we form with caregivers early in life. It shapes how we see ourselves and interact with others. When this bond is secure, we feel safe, loved, and confident. But sometimes this attachment can be disorganized. This can happen when caregivers are a source of both fear and comfort, leading to confusion and distress in the child. Imagine a child running to their parent for comfort, but then freezing or pulling away when the parent tries to hug them. This conflicting behavior is a hallmark of disorganized attachment. These children haven't developed a clear strategy for seeking comfort when they feel threatened. Disorganized attachment often stems from trauma, neglect, or abuse. It can also be influenced by parental mental health issues or inconsistent caregiving. The good news is that with the right support, healing and growth are possible. Understanding disorganized attachment is the first step. It helps us recognize the signs and seek appropriate support for ourselves and our loved ones. How do we identify disorganized attachment in infants? One way is through the strange situation procedure. This research tool observes how infants react when separated from and reunited with their caregivers. Imagine a baby placed in a room with their mother. A stranger enters, and the mother leaves. A baby with secure attachment might cry when the mother leaves, but will quickly calm down upon her return. A baby with disorganized attachment might react very differently. They might freeze, appear confused, or display conflicting behaviors like approaching the mother while looking away. They haven't internalized a consistent way to respond to stress. These behaviors aren't about bad parenting. They often reflect underlying issues within the family system, like unresolved trauma or mental health challenges. Early identification is vital. It allows us to address these issues and provide the necessary support. Attachment patterns formed in childhood often continue into adulthood. The Adult Attachment Interview, AAI, is a tool used to assess attachment styles in adults. It explores how individuals recall and make sense of their early childhood experiences. During the AAI, you're asked to describe your relationship with your parents. Did you feel safe and secure? Were your emotional needs met? How did you cope with separation or distress? Someone with a disorganized attachment style might struggle to provide a coherent narrative about their childhood. Their responses might be contradictory, confused, or lacking in detail. They might also display intense emotional reactions when discussing certain experiences. The AIAI helps individuals understand how their past experiences might be influencing their present-day relationships. This awareness is crucial for personal growth and building healthier connections. Section 4, Self-Reflection and Questionnaires. Clues to your attachment. While the adult attachment interview requires a trained professional, there are self-report measures and questionnaires that, can offer insights into your attachment style. These tools ask about your beliefs and behaviors in relationships. Do you find it easy to trust others? Do you feel comfortable depending on others and having them depend on you? Do you tend to withdraw or become overly dependent in time of stress? Answering these questions honestly can shed light on your attachment patterns. Remember, these questionnaires are for self-exploration. They don't provide a definitive diagnosis. If you notice patterns that concern you, it's essential to seek professional guidance. A therapist can help you understand your attachment style and develop healthier ways of relating to others. In Section 5, the therapist's lens, clinical observation and diagnosis. While questionnaires and interviews provide valuable information, clinical observation is crucial in diagnosing disorganized attachment. Therapists are trained to look for specific behavioral patterns and emotional responses. They observe how clients interact, regulate their emotions, and discuss their relationships. Do they exhibit fear or apprehension when discussing attachment figures? Do they struggle to maintain a consistent sense of self? Through careful observation and assessment, therapists can develop a comprehensive understanding of a client's attachment history and its impact on their current functioning. This understanding is the foundation for creating a tailored treatment plan.